we're now going to talk about infancy physical development. I don't cover much prenatal development in this class. I'll mention a couple things in the course of this lecture. If you're interested in prenatal development, you can find a lot of information about it online or in textbooks. I just think it's more interesting to cover children, and I have a lot of material I'd rather cover after they're born. So I start this class after birth. So right after birth, newborns undergo some testing. The most common of these is called the APGAR, and they test a few different items. The first is activity, the A in APGAR. So they're looking at muscle tone, so like leg and arm movements to see if the baby is active. Pulse is the baby's heart rate. The G stands for grimace, which is the reflex irritability. So they want to make sure that the baby responds to stimulation, that their reflexes are working. Their appearance, like their skin color, the tone of the skin, and their respiration, their breathing. This test is done about a minute after birth. It only takes a few seconds, really, and then about 5 minutes after birth. Each point is measured on a scale of 0 to 2. They are just looking for any red flags that suggest that the infant needs immediate medical attention. They do it twice to see if any problems that were present immediately after birth resolve by themselves. They also do a basic test of the baby's most important reflexes. The idea of a golden hour, I've mentioned it briefly. It's the first hour after birth in which bonding is optimized. So research has supported the idea of this golden hour, and many hospitals now support it. So for about an hour after birth, mom and baby should be allowed to bond. They need to be left alone rather than taking baby away for testing. The room should be kept quiet and dark with no visitors. Mom and baby should have as much skin-to-skin contact as possible, which means baby in only a diaper put directly onto mom's chest so their skin is touching. The first breastfeeding might be attempted. It's not often successful so early, but it should be tried. And this is a very important hour for the baby and the recovering mother. So they do test the baby's reflexes. I have a video here that shows you the more common ones, but there's more other than what's in this video. Please follow this link and watch the video on your own. These are some of the most common reflexes. Again, there's a lot more. So I want you to take your time to look at this chart. I'll just go through them briefly. It tells you the name of the reflex, what it is, about when it disappears, and why we think that baby has it. So the Babinski is when a baby's toes fan out, when the sole of the foot is stroked from heel to toe. So if you stroke their foot, you'll see their toes fan out and then curl up again. A blink is just baby's eyes closing in response to light or loud noise. The Moro reflex is also called the startle reflex. When the baby feels its head drop or has a loud noise, essentially when it's startled, it throws out its arms and then pulls them in again. The Palmar reflex is just when you put something in a baby's hand, it grabs on and it grabs on tight. Rooting is when you stroke a baby's cheek and it turns its head and opens its mouth. It's like it's trying to find whatever's touching its cheek and put it in its mouth. Stepping is a bizarre reflex. When you hold a baby upright and put their feet on the ground, they'll actually make the movement of stepping like they're walking. Now this chart says it disappears at about 2 to 3 months, but they've actually found that if you put the baby like in water, so the water's holding up most of the baby's weight, that reflex is still around. It just got hidden because their leg muscles aren't strong enough to handle their extra weight. Sucking reflex, obviously needed for feeding. When you put something in its mouth, it's going to suck on it, no matter what it is. There's also a swallow reflex that they need for eating. And then withdrawal. A baby withdraws its foot when the sole is pricked with a pin, so it's just a pain reflex. So all of these reflexes are important for baby survival, or they were in the past, evolutionarily speaking. So I'm going to take you through some sequences of physical development. The first is cephalocaudal. This literally means from head to tail. So it means that development goes from the head down. In prenatal development, you'll see that the head develops first and it's disproportionate to the rest of baby's body. The fetus has a head about half of its overall length. So this trend continues after birth until about adolescence, when strangely enough the trend reverses. So when children hit puberty, it's actually their feet and hands that grow first and then it moves upward. So proportionally, the head of a child is larger than adults. Next is proximal distal. This literally means near to far. It means development goes from the trunk outward. In prenatal development, the trunk or the core develops first. Essentially, the internal organs need to develop before arms and legs and hands and feet. It makes sense, evolutionarily speaking. Babies get control of the large muscles in their arms and their legs before they gain control of their hands or feet, or even their fingers. Fine motor skills, such as the fingers, things that you need to draw or write or color, tie a shoelace, those develop much more slowly than the big muscles. So at first, if a baby wants to grab something, their whole body will lunge toward it. Then maybe they'll try to reach for it with just their arm, but it's still their whole arm. Later, they can grab with just their hand, and lastly, just their fingers. Next is reflexive to purposeful. At first, movements are random and based mostly on reflex. Later, baby gets enough control to do the same movements on purpose. And we'll talk how babies learn to do this in cognitive development. But essentially, reflexes fade as babies get them under purposeful control, but the reflexes are still there. Next is differentiation. This is the process by which behaviors and physical structures become more specialized. Differentiation typically refers to a developmental process when a skill becomes more sophisticated and broken into subsets. For example, a child may learn to walk, and that skill of walking later becomes more sophisticated and breaks into more skills such as skipping, running, jumping, etc. The child has not reached a new level of walking per se, but rather differentiated one skill into multiple subsets. So growth. Growth during the first 2 years is insanely fast. The birth weight doubles by 4 months old. Weight actually drops a little bit after birth due to multiple factors, but it bounces back really quickly. The birth rate triples by 1 year old. Infants grow about 10 inches by age 1. Think about that for a second. 10 inches in 1 year. No other period of development matches this level of growth other than prenatal. So percentiles and growth charts. You've probably heard of this when talking about babies. A percentile means that an individual is larger than that percentage of the population. So 50, the 50th percentile, is the middle, meaning that that baby is bigger or longer than 50% of other babies. A baby in the 30th percentile for weight is heavier than 30% of other babies. So can you ever have a 100th percentile? No. You can never be bigger than 100% of the population. 100% would include yourself. You can't be larger than yourself. You can be in the 99.9th percentile, but never the 100th percentile. Same, you can never be in the 0th percentile. So this is what growth charts may look like. They have one for boys and one for girls. Growth does not occur in the smooth lines indicated by these charts. Remember, we talked about leaps and plateaus. Instead, they grow in spurts. Babies can go weeks without growing, then grow an inch overnight. I'm not exaggerating here. It's been documented. An inch overnight in 24 hours. There are separate charts for boys and girls. There used to be separate charts for formula and breastfed babies because they do grow at different rates. But the CDC now assumes breastfeeding. So that's what all the growth charts are based on. So anywhere between 10 to 90 is considered normal, but remember our discussion about average versus normal. So the 50th percentile is average, but anything within this range is normal. So here is weight based on the numbers over here. These lines represent length based on the numbers over here. Baby's birth weight, nutrition, genetics, etc. can all alter these rates, and babies will jump around between the percentiles, but they should stay kind of near the percentile of their birth rate. And as long as they stay within that 10 to 90% range, it's okay. They're fine. But you will see them jump around a little bit. They do not follow their curve. These curves are just averages for babies at all these different ages. So it's like they made points and then just drew smooth lines between them, but that is not reality. So why do they use these growth charts? Well, babies who drop down in the percentiles drastically in a very short period of time may be diagnosed with failure to thrive. So it's a good way for doctors to kind of assess the health of the babies and whether the baby is growing normally. But don't put too much stock in the growth charts. Remember that every baby is different and they'll grow at different rates. As long as a baby is healthy and happy, we shouldn't obsess about their weight and their length. Newborn states. The first is alertness. Newborns are usually only alert 1 out of every 4 hours, which is divided into inactive wakefulness, waking activity, fussing and crying, and then back to sleep. Babies sleep a lot. So alert inactivity, this is also known as inactive wakefulness. Babies are calm with eyes open and they're attentive, they're inspecting their environment, but they're not really moving around. They're just laying still, but their eyes are wide open. Next is waking activity. So again, their eyes are open, but now their arms and legs move in bursts of uncoordinated motions. They're moving around a lot. And we see crying. Cries, appears agitated, moves in uncoordinated ways. Crying is the first communication. It's the only way baby can communicate. And if you talk to any parent, they'll say that they can recognize the difference in their baby's cries. Babies do have different cries for different purposes. In general, there's 3 forms of crying. There's the basic cry, which usually means they're hungry or tired. It starts small and it gets more intense as it goes on. There's the mad cry, which is a much more intense crying. It means baby's angry or frustrated. And then there's the pain cry, a sudden loud burst of crying followed by a long pause and gasping. So parents can usually distinguish their baby's cries. Should a parent ever ignore a baby's cries? The answer is no, but I'll ask you again about that later. Next is sleep. Babies sleep about 16 to 18 hours a day. They are usually only awake for about an hour at a time before they go back to sleep. When they're first born, they tend to have day-night reversal. Remember, as fetuses, they tend to sleep when mom is active because they're in a liquid environment. As mom is walking around, it's almost like they're in a hammock being lulled to sleep. So as fetuses, they tend to sleep when mom's active and then come awake when mom lays down and is still. So they tend to be born with this day-night reversal, and it can be really hard on new parents, but as long as they try to institute a schedule, stay calm at night, be active during the day, the baby will switch. Some books say that many babies sleep through the night by 6 months, but be very wary of this. Every baby is different, and expecting a baby to sleep through the night that early can lead to problems. So the amount of time spent sleeping at a time varies widely by child. So again, be wary of any averages. Some may sleep through the night as early as 4 months, or some, like my 2, may not sleep through the night until they're almost 2. So just remember, every baby is different. REM sleep, that's the active sleep when you're dreaming. About half of newborn sleep is spent in REM. Researchers think that REM stimulates the brain and fosters growth of the central nervous system. In contrast, adults spend about 20 to 25% of their sleep time in REM, so babies spend a lot more time in it. So here's a sleep chart that kind of shows you the amount of time we sleep daily and how much of that is in REM. So you'll see in your 20s, you need about 8 to 10 hours of sleep, and about 8 hours of that is in non-REM and 2 hours is in REM. But over here in newborns, you see they're at about 16 hours of sleep, and about half is REM and half is non-REM. And it steadily decreases until we get to about this point here at about age 20, where the proportion of REM to non-REM stabilizes. But as you get older, you need less and less sleep. So just remember, kids need a lot of sleep. A 6-year-old needs 10 to 12 hours of sleep a night. A teenager needs 10 hours of sleep a night, and most of them are not getting it. So in the next video, we're going to talk about brain development.